and morning everybody. Hope everybody's had a lovely weekend. And I think I'm the same as you, Kay. I always wish the week away, waiting for the next Friday. I've put together a couple of slides which I will share at the end. Forgive me, Tracy, I might have already shared them with you previously, but if not, I can send you them to circulate. Just rather than it just being just me talking at you, at least as a little bit of a visual for everybody. So I'll just share my screen. Can everybody see that okay?
Yeah.
Perfect. Okay, so just a little introduction before I start. My name's Katie Reid. I am the Partnerships Manager for Triage. And for those that aren't aware of Triage, we are an employability and training provider who have been in the Northeast and the Tees Valley for just over 15 years. We've delivered every major DWP programme from work program, flexible New Deal, the refugee employability program, JETS, every major DWP program we've delivered. And just to give everybody a little bit of a flavour for where we deliver, we've got our heartlands are in Tees Valley in the northeast. We're also in the North and West Yorkshire, Hull and Humber, South Yorkshire and Scotland as well, just to give everybody a bit of a background of us as an organisation. So I'm here today to talk to you a little bit about Connect to Work. And forgive me if anybody already knows a lot about Connect to Work, but I'll just go with a majority and just go through an overview just to give everybody a little bit of a flavour of what the programme is. So Connect to Work is a voluntary programme. It runs for quite a substantial amount of time, which is lovely in the environment that we're in. It started in October last year and it'll run for 5 years and see us through until March 2030. And it's based on the proven supported employment model, which is trying to place somebody into work at the earliest in intervention and trying to support the employer and the individual to remain in employment. There is 2 elements of Connect to Work. Triage will be delivering the first one, which you can see, which is individual and placement support, which I'll go through in a little bit more detail. And there is also the SEQF element, which is Supported Employment Quality Framework. And in the Northeast, it'll be each local authority will be delivering the SEQF element. The biggest difference between them and the easiest way to think of them is anybody who goes under the SEQF element requires more intensive support, and it is those that perhaps have a neurodiverse condition or a registered learning disability and needs perhaps a little bit more support than others. Triage will be supporting on the individual placement support, so the IPS intervention, and that works with everybody else. So anybody with mild mental health, moderate mental health, those with physical health conditions, or those who fall under a disadvantaged group, which I'll come on to later in a couple of slides. So it just gives you a little bit of an idea of the 2 interventions. But before I move on, if somebody was sent across to us and perhaps their main barrier was autism, we would still work with them and be able to triage them and be able to put them to the relevant provider who offers that support. So within the Northeast, Triage will be delivering Connect to Work in 5 of the 7 local authority areas. So the only 2 areas we don't deliver Connect to Work is South Tyneside and Northumbria. So we deliver in County Durham as a lead provider. We've also got 2 delivery partners under that, which is Groundwork and Rethink. We deliver as a lead provider in Gateshead and Sunderland, and we are part of a supply chain for Groundwork Northeast in North Tyneside and Newcastle. So again, just to try and put the point across that we're in 5 areas as opposed to the full 7. Individual placement support is an intervention that integrates really well within primary care services and secondary care services. And it supports individuals who are either registered disabilities, health conditions, or who form part of a disadvantaged group. If anybody is familiar with IPS, you may have come across it within the NHS. So the NHS will deliver IPS for those with severe mental illness. You may have also come across the IPS intervention for drug and alcohol support as well. And what IPS is it's a proven model, and it's underpinned by a fidelity model and a fidelity scale. And it's to make sure that providers who deliver IPS are reaching target, they are having enough people on their caseloads, they are working with enough employers and really delivering a good service. So just to give you a bit of a flavour for what we will be doing with individuals is working with them to sort of come away from that mass recruitment and look at what type of roles they want to do, even what employers they want to work for, and approaching the employers on an individual basis. So doing that sort of job carving, that job spec into employers, and then looking at how we can make any in-work adaptations, how we can encourage the employer to take on more of a diverse workforce, or even just make sometimes minor or reasonable adjustments to be able to move into employment. The key integral part, and again, this is one of the reasons why we wanted to come onto this call today, is about that clinical setting. As part of our model, we will be basing ourselves within primary care services and secondary care services. And we wanted to work really closely with the Workwell team and the PAS service to be able to look at how we can support without adding duplication, and how we can be able to sort of make sure that if there is a GP or a social prescriber who is wanting to refer into us, that we're all working together to make sure it's the best service for that individual. So just quickly moving on to the eligibility and suitability for Connect to Work. So again, Connect to Work is designed to support somebody who is wanting to move into employment, to be able to find suitable and fair and paid sustainable employment. So it's the eligibility is that the person must have a disability or long-term health condition that does not have to be diagnosed. It can be something that the individual feels is preventing them from moving into employment, or they need to belong to one of the disadvantaged groups on the right-hand side there. And just to give you a little bit of a flavour, it can be somebody who's an ex-offender, a refugee, a survivor or a victim of domestic violence. There's quite a few that obviously I won't bore you with them. They're just on the side there for you to read. I appreciate the majority of the individuals you will be working with will have some form of health condition. So eligibility is never usually a problem for Connect to Work. It's the suitability that we want to go through. And what we mean by suitable is if somebody is wanting to explore the option of work, and it's within their view that they would like to move into work within the next 12 months, then Connect to Work will be the programme for them. If somebody isn't wanting to move into work and is not one of their goals, Connect to Work wouldn't be the right programme. And the reason being is because it's quite intensive and it's quite, we're wanting to try and place people into work at the earliest intervention. If somebody isn't wanting to explore work, it's not going to be the right option for them. Somebody doesn't have to be ready for work. We've worked and we've placed people into work already that have been really long-term unemployed, 5-6 years unemployed, multiple sick notes. But the difference is they are wanting to explore that option. I always use this really cheesy term, you can lead a horse to water, you can't make it drink. And that's usually what we say from a suitability perspective. If somebody is that you're working with is, doesn't have any idea of what they want to do, but knows that they would like to move into work with the right support, that's absolutely fine. But if somebody's not wanting to explore that, it wouldn't be the right programme. Just a couple of key facts from a Connect to Work perspective. Across the North East, it will support over 5,000 people. And the whole aim of the programme is to reduce economic inactivity, and to try and move people into employment to actively contribute to society. Connect to Work will support both in work and at risk of falling out of work. and also those that are unemployed. The majority of the interventions that we will have will be supporting those that are out of work and unemployed. But if you do come across anybody that is in work and struggling, that could be from a recent bereavement, it could be from a health condition, any reason, we can support them. Again, I've touched on the fact that we will be integrated in clinical teams. So, Kate, it would be great to have a further conversation with yourself about how we can look at that that support that we can offer without adding duplication. The majority of the interventions that we will be having with people will be within community settings. So we do have offices in each of the areas that we deliver Connect to Work, but we appreciate that we want to make it comfortable for people and be in a safe environment to conduct our appointments. So that can be in local cafes and community centres, and that's just to promote engagement, and we'll try and meet them at a place that makes them feel most comfortable. Again, that can be within a clinical setting, that can be within a GP practice if that makes them feel comfortable as well. The element that we will be focusing on the most is that effective work that we do with employers. So to make sure that we are successful in our delivery for Connect to Work, again, it's around that individual's preference. So if somebody is wanting to work for a particular employer, it's around that job carving and that job matching to make sure that we're speaking to employers on behalf of those individuals, as opposed to just sending, mass CVs off, perhaps not hearing much feedback. It's very individualized, and around what the individual wants. So working together from a work well and PAS perspective, for us as an organisation, again, we don't want to duplicate what's already working. We don't want to add in a service that is going to confuse people and referral partners. But we understand that obviously the PAS service, Work Well and Connect to Work, IPS, all do involve that integration within clinical services. That'll include primary care in secondary care services as well. So from a Workwell perspective, Workwell does act as a preventative service, and works with individuals that are in work at risk. And forgive me for the eligibility. I do believe it's up to 3 reoccurring sick notes. Anybody else who is in on more multiple sick notes, Connect to Work and support. So we can support anybody from that first sick note if needed, but to somebody who's had, multiple sick notes or on long-term sick, to support them back into employment. From a PAS perspective, we understand that PAS is integrated within quite a lot of the GP practices across the Northeast. From ourselves, from a caseload perspective, and to fall in line with Fidelity, Connect to Work caseloads are capped at 25 individuals. That includes in work and out of work. So to make sure that we've got the time to spend with employers and to spend with individuals, we do have a lot more free time to be able to work with them and offer a little bit more intensive support. So what I would really welcome is if PAS is in a particular in a GP practice, for an example, and that's working really well, we want to know about that so that we're not, offering that duplication. But if PAS is in a GP practice and perhaps there is big waiting lists, or they're struggling to see as many people as they would like, how Connect to Work can fill that gap and be able to support alongside that service. And again, just touching on that employer approach, that is a huge part of our IPS for Connect to Work. It's about that speculative approach. It's about looking at them in work adjustments, reasonable adjustments. Sometimes that can be quite minor. That can just put somebody over the line to move them into sustainable work. And I'll stop sharing my screen. You'll be quite happy to know that I've finished on that update. Again, there's a lot of information that I've fed within those slides that I will send out to everybody. If anybody does have any questions, please do let me know. I'll just have a quick check of the comments. So just one of the first ones is have you already linked up with Workwell services across North East and North Cumbria? I work quite closely with Laura Barron, who I believe heads up from a County Durham perspective. But I'm struggling to find the contacts in the other areas. So it would be great if anybody could share how we can integrate within the Workwell services across Sunderland, Gateshead, and Newcastle and North Tyneside would be fantastic. Um,
Yeah, can I just come in there? Sorry, yeah, just
yeah,
so every colleagues are aware that Katie is not covering the whole of the North East North Cumbria region. So you've got the contract in certain locations, haven't you, Katie? So there's
yeah,
certain ones you don't. So is it worthwhile just popping in the chat, Katie, which specific areas that you're covering as part of the triage contract in amongst all that? So people do know which ones. But it's the same service offer for users individuals, so it's the exact same service offer as just triage. Have got the contract in certain areas, and other people have got a contract in other areas. But this connector work is there's no variations in that. It's set in stone. So they're just different people are delivering the contract. But
that's yeah, that's
but
right.
yeah. But if Katie puts that in, we're going to look at that, and I'll pick up a call with you separate, Katie, so we can and speak about how PAS can connect into it.
Brilliant. I've just popped that in the chat, but
Thank
again,
you.
it's in the presentation that I've just gone through just to cover.
Yeah.
Obviously, I understand that the regions that I've just put in there, the vast, for an example, Sunderland Connect to Work covers the whole of Sunderland, and again for all of the other 5 areas as well. But yeah, it would be great to have a further conversation, Kay, to look at the areas that perhaps PAS doesn't cover, or even if you are and you've got perhaps more waiting lists, how we can come in and support alongside that service.
Probably need to look at things through between all three because we've got a bit of a process between PAS and Workwell when it comes to waiting this time. So maybe it's where we'll probably need to link the three together if that makes sense
Yeah,
in amongst it all.
yeah.
Um,
An
so
approach that we've been taking with County Durham for the Workwell service is because the work with individuals who are in work and at risk of falling out of work, again, I think it's up to 3 month reoccurring sick notes. We've tried to put like a bit of a process in place that even though we can still support those individuals, we're encouraging them to be referred across to Workwell, and then we'll work with everybody else so that it's not duplicating that service. So one of the surgeries that we're working out of in Sacriston, anybody that's on or at risk of falling out of work or in work and struggling, um, if they're within that eligibility for Workwell and they have up to 3 reoccurring sick notes, they will be referred across to Workwell.
mm,
If they are outside of that eligibility and perhaps they've had, multiple sick notes, then they'll be referred across to us. And it's just to make sure that there's no wrong door approach, and that we're working together if what's best for that individual really.
we probably need to work through because we don't have an eligibility criteria with PAS. So, but we'll talk about that separately. We'll pick that up as a separate conversation. Yeah.
Yeah, that'd be great. I think Steph's put in sorry, there's a couple of comments coming up, that's all. So I'm just gonna
Yeah.
have a quick read through them. Nicola McDougall's put if I can send information across for Newcastle, Gateshead, and North Tyneside, I can share my email. So I'll pop my email in the chat for anybody. Um, pop that in the chat there. Rachel Barham, I can see you don't cover 2 areas. It would still be worth touching base as there are 2 digital solutions being rolled out across the whole region. Absolutely. Again, Rachel, I've popped my details in the chat there. Please do feel free to reach out. And if anybody is wanting to know who the contacts are for Connect to Work in South Tyneside and Northumberland, I'm quite happy to share those details across. I can share them across to yourself, Kay, and then you can disseminate to the team
Yeah, please.
if that's helpful. Sophie Rowe, could you explain a little bit about how employers are approached and connected with? I think this is more personalised connection with employers is really valuable, and I'd like to be able to explain this to people I work with. So again, Sophie, this is one of the parts of the contract that I really like. So we've tested quite a lot of different ways of working with people, and sometimes it's just about what that individual wants. So we've had conversations where we've said, right, you name 5 employers that you would like to work for in your area, and let us do that legwork for you, and let us try and contact those employers. It doesn't always have to be employers that are recruiting. Sometimes there's hidden, you'll know yourselves, there's a lot of hidden roles that are out there. And it's just about that individual approach. So, going to an employer and saying, right, I've got job logs here. This is the benefits of taking them on. This is the type of work that they would be able to do. Looking at your job description, they would be fantastic in this, this, and this. However, I do feel like they would struggle with this element. Is there any way that we could perhaps change that? Is there any support that we can put in place? Is there somebody else that could perhaps take up that particular duty, and really encouraging the employers to understand the benefits of making those small, reasonable adjustments. Sometimes it doesn't always have to be around health. Sometimes it can be around their personal circumstances. That can be childcare. It can be being able to get to a certain destination at a certain time. I mean, for an example, I don't have any health conditions, but I've got childcare needs, and triage I've put in place. If I need to move to another office space, I don't have to be there for 9 o'clock because it's just not feasible for me. But I've got that reasonable adjustment in place, and what they're getting back is a valued member of the team, an employee who's going to be showing up for them and doing my best to my ability, sort of thing. So it's just about having those sort of on the ground conversations. But it's not to say we won't come up with these employers. We've got a lot of employer contacts across Tees Valley and the Northeast in particular. But sometimes it's around, who do you want to work for? What type of employers, would you like us to look at? And coming up with those solutions together, really. So again, I hope I've answered that question for you, Sophie. Anthony, Colin Stratton has engaged with the Employment and Skills Service in North Tyneside, so have contacts for you. Perfect. For those that aren't aware, Colin is one of our IPS specialists. Tracy, query originally from Laura Barron, an area for development for some advisors. They are keen on employment law. If, for example, they are looking to support a work-well client approaching the employer to discuss reasonable adjustments, they'd like to have a better understanding of what is required by law and what is good practice. Again, I think I've reached out to you separately with this, Tracy. We're putting a package of training in place for our IPS specialists to make sure that they're fully up to date with current law and current requirements. There's been quite a lot of changes over the last year when it comes to the rights and responsibilities for an individual and also an employer. We're just in the process of finalising some of those training sessions. So once we have that up to date, we're more than happy to share that. And it is, we're happy to do that type of learning because it's all facts. It's all things that are going to benefit for the individuals that we're working with. So I can send over some of the content of what we've got.
Brilliant.
But what we try and do as well as an organisation is we've got daily buzz sessions for each of the areas, and any difficult conversations that we've come up with an employer or a particular individual, we talk through it as a collective as well to try and come up with different ideas. But as soon as that training's finalised, I can share that across. That's no problem.
That's brilliant. I suppose while I'm on that point, Kay, I didn't know whether you and your team, have any particular sort of information around that for others as well. I think we need to come at it from, from all angles, really.
Yeah.
Not sure. I can ask though, but not sure. Some of them are on the call today, probably, so they might have. I don't think they have. I'm going back and forward in my own head. I don't think there is any particular training around employment law.
I think sometimes it's just with the recent changes as well. And I think one of the biggest ones that's come in recently is that, day one employment rights and, from a sick perspective and And sometimes it's quite, well, I say sometimes it's quite daunting for an employer to take somebody on straight away, and it's just having them encouraging conversations. And I think because, especially on Connect to Work, with caseloads being so low, a lot of the time will be spent with employers. So that can be working with the individual and the employer during that in-work induction, going through the training plans with them. And it's encouraging feedback that we've had where an employer's thought, actually, we've got a second entity and a second service that's been able to support us within the business, as opposed to just us taking somebody, like the employer taking somebody on and then them not getting any advice or guidance whilst that person's employed. Forgive me if I've lost a couple of questions here, but I think I'm on track. Christine Jordan, HIN North East North Cumbria are working closely with the ICB on the digital innovation services integrated into Workwell and PAS. At the moment, the referral route is through a PAS advisor or a work coach. However, we are looking to extend the referral route from April. It would be good to catch up on this. Christine, that's music to my ears. That sounds fantastic. And I've had a separate conversation with Claire Mills about the same thing as well, that it's looking at getting extended. So Christine, if you can just, I've popped my email in the chat, if you can just reach out to me and we can pick up a further conversation around that, that would be fantastic. Himlan Spencer, I think you possibly have a link with public health team for Sunderland through Sarah Potts. We do have a link, but again, it's just that growing relationship, because we appreciate we'll speak to different services. Obviously, they've all got their own agenda and their own priorities. So it's just, we're really keen to make sure that link's maintained. And if there's anything else that we can do in that situation, whether or not that's trying to integrate a little bit better, or come into team meetings and share best practice, we're really keen to do that.
Katie, if you'd like to share the slides with me, and I can send them out to the whole group.
Yeah, that's no problem.
Thank you.
There's a couple more comments, but I think the majority of the questions have been answered. And if they haven't, please just re-put them back in if I've missed them. That would be great. So thank you very much for your time. If anybody does have any questions, please just reach out.
That's lovely. Thanks, Katie. Thanks very much. Any last questions from anybody?
Just milk. I've got a tea bag here, look.
Oh, somebody's
got a tea bag and they've got milk.
I can't offer tea bags. I can offer to help people into work, but not tea bags.
Lovely. That's great. Okay. I mean, that's only taken half an hour, so that's great. We do still have half an hour left if people require it. Again, as I said, this meeting is about the people out there doing the doing. So please come in. Kimland, please come in.
Morning, everyone. My name is Kimland, and I'm new to the post. So today is my third Monday. I'm the public health practitioner for Health and Work. It's a new role in the Sutherland City Council. What I would like to do is we're trying to strengthen our partnership in terms of finding the gap and any loopholes in terms of how we can build health or more health perspective for into work and skill. So we're the public health, how we can influence work and skill. So any organization, voluntary sector, charity that is under either health, either work, or either skill, I would love to do a partnership with, because what we're trying to do is understand what's going on in the Sunderland city and in the local borough, in what we have to provide for residents in terms of encouraging more upskilling and more work. And also if they have any health conditions, any underlying issues, how we can support them. And that will go well with Connect to Work in terms of trying to keep people who are falling sick from out to work, how we can support them to stay into work. So back off sick note, or if you're about to see occupational health, how we can support you. And also people who have never worked or who are out of work for a very long period of time as well, how we can support them with their upskilling, training, or any form of pre-working coaching to bring them back into work. So I'm trying to do a mapping, trying to understand what organization we have, what funding we have, and who are the contacts in Sunderland. So I'm about to do so. So every contact is important. Every organization is important. I would like to know the purpose, who your target groups are, if there's an age requirement towards, if there's a criteria, what is your funding cycle like, who are like your key stakeholders, so I can get like names, who are the specific people to get names from. So that would be great. And I'll put my email down as well. You will see me popping up at some meetings. I'm quite new, so I'm learning everything that's going on. So I was just dragged into this one today, but I'm grateful to come. We are working with Connect to Work, but that's through Sarah. So I would love to know how more we can get more influence and more public facing from the public health side of the council to get involved. So thank you, everyone.
Thanks, Kimberland. That's great. I'll obviously pick up with you later as well this week, which will be lovely. And any information, like you said, we can share out with this group via email through our full distribution list. So that's great. Lovely. Has anybody else got anything? Christine's just put another reminder in there as well. That's great. Thanks, Christine.
Does Christine want to pop on and just give a reminder?
Yeah,
yeah, I can do. Just yeah, hi, can
Put you on the
hear me?
spot.
Just I know it's just my sound's playing up. I don't know if you can hear me.
Yeah,
just another gentle reminder. I feel like a broken record. I feel like I'm pestering everybody, but it's just that these really good services are available now, the digital innovations. So it's just a gentle reminder just to say, please do start referring and signposting people to these innovations. You know, it's really simple. That we've put the relevant links in the chat there. So yes, so they're available now. So please do just tap into them. And if you want any more engagement events or a demo on the actual service, then just reach out. We can arrange that. Anything else you need, if you need any flyers or posters, we've put all the relevant information in the shared DWP shared area. So that's in there under the relevant folders. So there's a folder called Digital Innovation, and then there's one for Dr. Julian and one for Sword, etc. And I'm just about to put the Tell Me referral link as well in the chat, but that is only for people in South Tyneside and Sunderland, because that was a pilot in that area. And then the same for Rachel as well, who's leading on XR Therapeutics, which is only in Teesside or Cumbria. So yes, so if you need any more information, please just reach out and start accessing these services, please. I know.
Thanks, Christine. No, and this is what this is about. This, you know, people are so busy that sometimes reading emails isn't, you know, in their gift, is it? Because they're so busy on the ground. So coming along to a meeting and hearing people talk about things is sometimes the only way people get to know things. So, you know, we just need to keep trickling this information, and you'll see I'm often trickling information and continuously talking about the same things over and over. But you know, that's what we're here for. If we are missing anything, people need to let us know. I just wanted to touch base on the access to the shared area. I just want to make sure that people are able to access that shared area. I did put a link in my email that I sent yesterday, just as a reminder. You know, this is where we're hosting a lot of the information that we talk about. We host there's links to the recordings of these meetings if people want to watch them back. And you know, all of the different pieces of information, including a lot of the digital innovations that Christine's just talked about. So if you know, if you haven't got access to that SharePoint shared area from the DWP site, you need to contact Steve. Is that right? Still right, Kate?
Yes, Kate is in the background.
Oh, I know. Steve, can you put your email address in the chat, please?
I was just putting it in for him there.
Oh, lovely. Thank you. So yeah, anybody who needs access to that SharePoint area where all of the information is for our PAS advisors and work coaches and health and wellbeing coaches and anybody else, you know, that's where we're hosting everything. So please do look into there. Kay, did you want to come in there?
Yes, I was just going to say, has anybody with these provisions have cost a lot of money, and they are fantastic services. We need to use them. If we don't use them, we'll lose them. That's the top and bottom of it, isn't it? So we have been crying out for so long that we don't have enough support in the, when it comes to health and people being able to remove the barriers and support them towards employment. We've been saying for such a long time we don't have enough provision, we don't have enough support. We've now got it. Colleagues, you need to use it. If you don't use it, you lose it. So the whole thing of it, when we've got to think of this whole program, so the Health and Growth Accelerator, which is the WorkWell program's part of, is a pilot, and it is being monitored, and it is being assessed on the value for money, and what we've done in amongst on that is it helping people in our community. So we need to make the most of using everything that's at your fingertips. So when it comes to if you're working with a young person that's struggling with the mental health or confidence skills, tap them straight in, carry on working with them, but tap them into the additional support, maybe through Tell Me or one of the other programs, or Dr. Julian. You've got to use them. If you don't use them, you'll lose them. So I was just wanting to come in on amongst that. And also to say, has anybody on the call started using any of this provision that can pop along and tell me what their thoughts are so far, and if I've had any feedback? Because I think that's really beneficial if we get actual feedback from any of the provision. So has any colleagues on the call used it, or had the people they're supporting used it so far? So that means not yet. So that is a big problem. Oh, somebody has. Fantastic. Lindsay.
You just on mute there, Lindsay.
That would help, wouldn't it? It's Monday. Yeah, so I'm Lindsay. I'm from the Sunderland GP Alliance. So we've mapped kind of all of the digital innovation out, the personal health budgets. We've done a personal health budget last month. We've got a few in the pipeline as well. So it's new learning, but people are taking up that offer. The digital innovation, we are tracking that. We're offering it to everybody, but we're not getting as much uptake. But we're still persevering, and we're still learning about each one and making sure, you know, we explain it right and things like that. We possibly have got somebody for SWORD this month. I believe my colleague Estelle's on the call. She'll be able to tell we're in detail more. So we are making sure that we track that we're offering, but we're not getting as much at the moment. But it's early days.
Can I ask if anybody, thank you for that, Lindsay. Can I ask anybody, though, that has used them, when you do come to use it, and if anybody's got any case studies, examples of when it's been used, can you please share it with us? Because that's the thing that makes the difference. If you can explain how it's been used to a patient, the benefit it's had to a patient, and instead of just saying, we'll refer you to this provision, if we can explain when it's been used, how it's been used, and the difference it's made to an individual, that's the stories we need, because that would help you, Lindsay, to sell it to the people you're working with, rather than just referring everybody, and explain why, what it's going to make.
We have started some case studies. So we sent one to Hannah Jeffries last month, I believe, and we are kind of working on that. Like I say, it is early days, but we have started quite a lot of case studies that Estelle's involved in as well, and letting people know, because I think you're absolutely right. It's how you explain it to people. It's kind of, you know, putting into practical terms. Well, you can use it for this, and you know, the team are doing that. And I think, yeah, you just need to maybe explain how it can be beneficial, like the personal health budget. We've kind of thought a little bit different about that, because it's so open, isn't it, to kind of to what the person wants. Which, Estelle, I don't know if you want to come in and just, if we've got time, to let everyone know about the personal health budget one that you've done recently, because that was really good.
Yeah, definitely. No, I can explain a little bit about that. So yes, we've done one personal health budget, and that was for a man who was referred into WorkWell. He had chronic back pain, so he'd been out of work for about 7 months, and had the conversation around what would help him, what's helped him in the past, and what came out in that was deep tissue massage. So yes, so we were able to apply for 6 sessions of sport massage, and he was successful in getting those. So that was about £300. And yeah, so that was to help him to manage the pain. So.
And he is doing a phased return back to work, isn't he, Estelle?
In
8 weeks' time.
He's in the discussion around phased return with his employer. So yes, that's his next step. So yeah.
Thank you. That's brilliant. Like I say, can we keep sharing these? Maybe can we put something in maybe in the SharePoint folder, Tracy, where people can pop in
I was just thinking,
case
yeah,
studies?
we've got a case study template, which is just a very basic template, with, you know, of to help you build your case study story, because ultimately that's all it is. It's just telling us a little bit of the story of how you improved or helped somebody stay well or whatever. You know, as long as no names, no patient identifiable information is shared, we just need the story. That's great. And again, this is what NHS England are looking for. You know, what is that impact that we have made through all of our resources and innovations. We are seeing data coming through through the WorkWell service, which I think I'd like to be able to present at some, you know, maybe next month's meeting, to be able to show people, you know, the data that's coming through. This is based on the work that you lot have been doing, you know, and this is what NHS England are looking for. You know, they've ploughed a lot of money into this, like the whole program, and we want to be able to say, look, this is what this is the impact the money's made. And as you know, as Kay's already said, you know, if we continuously trickle feed the impact and show that the positive outcomes that that we're seeing, the chances are they're going to, you know, say this is worthwhile, have some more money, please, you know. So that's our aim, really. Christine, I know you've been waiting patiently there. Do you want to just come in?
Yeah, it's not really a question. And it's related there to the data collection. It was just for Kay, really, just to clarify that the PAS advisors can definitely signpost now, can't they, to the digital innovations?
Yeah,
that's brilliant. Until I know you've got issues with the data collection.
we're
but
sorting all that capture, and I've got meetings the next day or two with their managers to sort that how we capture that. Well,
so we've all got the
other things
green
sorted.
light. That's brilliant.
Yeah.
Marvelous. That's
Yes.
great.
Right. But I'll put a copy of the case study template in the SharePoint area for people to access if it's helpful. But likewise, you know, even if you drop an email into people, we'll take information any shape or form, whatever's easiest for people.
Lovely. Thank you.
Any other questions or comments or stories that people would like to share? No, okay. Well, that's lovely. Katie, thanks again for coming along.
Christine's back.
Sorry, yeah, it was just really quick. I know there'd been discussions about doing some training needs assessment or training needs skill analysis, because we'd be interested to look at motivational interviewing for WorkWell coaches and PAS advisors. I was just wondering if there was any more progress on that.
So we originally did a TNA kind of survey out to people. We didn't have a great response, but the response that we had, it was more about understanding. I think that the needs that people wanted was about understanding the pathway, the referral routes and such like, which I think we're addressing as we go along anyway. It might be that it's a good time to perhaps run that survey again from scratch, just to see it actually, while now that people are in their roles, and we know there's new people coming into roles all the time, is perhaps to understand if there is any gaps there in that training needs that people require. There has been another survey distributed just while I'm on that, which we had public health consultant Jill Harlan from Northumbria Trust came and spoke to the group last month, and a survey went out. I did send that survey out again, and I've sent it out a couple of times. We'd appreciate if people, particularly the PAS advisors and work coaches out there, if you could complete that survey, that would be great. That's about barriers to accessing healthcare appointments or other services. That might give us some information as well. So, if these surveys do land on your email, please do take the time. It'd be, it's really helpful. We can sort of progress things. Okay. Right, anything else from anybody? Okay, thanks again everybody for joining. The recording of this meeting will be put up onto the SharePoint area to share with colleagues. But thanks everybody, thanks Katie, and we'll see you all next month. A date will be in the diary soon. Thank you.
Thank you.
Take
Thanks very
care.
much.
everyone.
Bye.
Bye. Bye.